Thank you, Mr. Speaker, sir, and thank you, Honourable Member, for the question. The National Family Planning Policy of 2025 to 2030 was developed through extensive consultations and collaborations between the various stakeholders, interested stakeholders, the practitioners, experts, those that serve in the front line, and together with our partner representatives and experts from within the ministry. It was launched in earlier in the 21st of July this year and was attended by members of the diplomatic corps, development partners, UN agencies, government representatives, civil societies and NGOs. And the document is not just a policy, it's a historic milestone for our nation as it reflects a unified national vision to improve health, rights and the futures of every individual and family across our beloved country. And the policy itself outlines 4 key national commitments. 1, to ensure family planning services are accessible and inclusive. Secondly, to strengthen and revitalize the delivery of high-quality services that are available, acceptable, affordable, and provided by skilled personnel at all health facilities. To improve health service delivery for vulnerable populations, including people with disabilities. And 4th is to integrate family planning into Fiji's emergency preparedness response and recovery framework by 2030. I'd mentioned the 4 key commitments, and it's how we will operationalize it. It's through our extensive workforce and in terms of the facilities that are available throughout the 4 divisions. So we are very grateful that the policy is there, and now it's just to action the policy so that it has some impact on the ground with our people. Thank you, Mr. Speaker.